Hello, everyone. I'm excited to have Dr. Kala with us here today again. She, as I said before, she is a established general dentist with over 10 years of experience, and today she's here to talk with us about a fantastic solution known as dental crown. Next, we're gonna hear from Dr. Kala about what are dental crowns and many more things about it. So please, Dr. Kala, educate us.
Thank you for watching, everybody. Hello. So, today we are going to talk to you about a dental crown. Sometimes patients come in for a consultation and they may have some pain or discomfort or a crack on a tooth, and we may tell them, hey, we're recommending a crown. And not everyone may understand what that really means. So, this video is supposed to help you understand the procedure, ins and outs of the crown. Of course, you will refer to your general dentist for your specific needs, and this is by every mean only educational. So, a dental crown is basically a dental prosthesis that replaces your tooth structure and creates the normal contour, which would be hard to create with something just like a filling, especially if you have lost more than 50% of your sound tooth structure. The ways to lose your sound tooth structure could be because of cavities, larger restorations or fillings done in the past that are now cracking and leaking and having recurrent decay and bacteria underneath them, or a tooth that may have undergone root canal therapy and now needs a crown to make sure the tooth doesn't fracture because of the forces of occlusion. So, a crown basically is just that, a cap on top of the tooth.
Thank you so much, Dr. Kala, for explaining us about dental crowns. I have one more question for you, and it is often I get questions that do dental crowns are really necessary after root canal treatment? Can you just say a little more about it,
It's
please?
a very good question and very valid too. So, after a root canal treatment, you have to understand what's going on. We are removing the inflamed nerve from within the root of the tooth. Once it's gone, along with the nerve, the blood supply of the tooth is gone as well, and the tooth becomes non vital. So, the tooth becomes dry and dehydrated, and it becomes more prone to fracture, especially if it's a tooth in the back of your mouth. So, if a root canal has been done on any of your premolars and molar teeth, it is highly recommended to get a crown on the tooth. Now, if you had a front tooth and it underwent a trauma and it broke in a manner that 50% of the tooth has gone or more, then again, after a possible root canal, you may need a crown. But if there is a tooth, for example, a front tooth, got a cavity or maybe an infection which required a root canal treatment, but minimal reduction of the tooth was done, a basic small little access opening was done to treat the tooth, and the rest of the tooth is intact, then that tooth may not need a crown. So your dentist will determine, depending on how much tooth structure is lost, what is the placement and location of that particular tooth, whether you're going to need a crown on or not after a root canal. But in most of the cases, the answer is yes. But in some cases, no.
So, Dr. Kala, let's say if I get a dental crown, will
Correct.
they look like my normal teeth or are they distinguishable?
Absolutely, they will look like your normal teeth. We work with excellent ceramists and we have great technologies in place. Our office takes pride in offering CEREC same day crowns for our patients as well, which goes, and we've all undergone rigorous training for it. The crowns that we place on our patients nowadays are mostly white, tooth colored, zirconia, and porcelain based crowns and Emax crowns. So you will not be able to distinguish. A layman cannot distinguish whether it's your natural tooth or if it's a crown. Sometimes even I can't tell. So yeah, it's really very accurate, and you don't have to worry about aesthetics. It is our priority to make sure they match your natural teeth.
I gotta say, Dr. Kala, that's a relief. That's like a music to my ears to hear
Of
that. By the way, just one last question:
course.
are there any chances of getting cavities on the crown tooth?
It's a very excellent question. You have to understand the tooth with a crown is still a tooth with a crown. A crown is covering the tooth. Now, if oral hygiene gets compromised and you start having gum recession or bone loss around your tooth, which happens in terms of periodontal disease, then the margin where the crown meets the tooth can sometimes open up. It can trap food if we are not flossing around our crowns, if we're not using proper brushing techniques, if we're not getting these margins clean, then food can accumulate around them and cavity can still form on our root or even the tooth where the margin of the crown meets the tooth. So, yes, proper maintenance, like anything in the mouth, is very important. The most easiest thing to maintain, honestly, is your natural tooth. Anything that we place in requires maintenance, requires regular visits, and requires good protocol that we go over with all our patients. So there are no questions about what they need to do to maintain their dental work.